Hi guys, welcome to New Age. Thank you for checking out our page. Breast lift surgery. There's a few different ways to do a breast lift, and you really want to balance out a couple of things with the patient. You want to give them the maximum amount of a lift, and you want to minimize the amount of scars. There's really 3 different types of breast lifts, and sometimes we use implants at the same time. That makes things a little bit more complicated in the surgical plan. Easiest type of a breast lift is one where we make a scar around the areola, so just in a circle. This is great because it minimizes the amount of scar, although the downside is it doesn't actually give you that much of a lift. So typically I wouldn't do this unless I was also doing an implant at the same time. A lollipop breast lift is one where there's a scar around the areola, straight down. And this is something that is kind of like a medium amount of a lift that you would get, and it's also commonly done with implants. The last type of a breast lift is one called an anchor or a inverted T or a Y's pattern, where the scar actually is the same as a lollipop with the circle around, straight down, but also a scar in the crease. This will give you the maximum amount of a lift, but it has the biggest scar burden. This is something that typically I would not do unless someone had gone through something like a big weight loss. These operations all take different amounts of time, and they all require a general anesthetic. If people need an implant done at the same time or want an implant done at the same time, there are a lot of other considerations that have to come into play. Breast augmentation with an implant and a breast lift are going to work in opposing fashions. So when we talk about a lift, we're not actually lifting anything. What we're doing is we're tightening tissue from the bottom and raising stuff up. You can't actually lift a breast up. If we were to do that, we would have to put a scar up here, which is not something any plastic surgeon would ever do. So with a breast lift, we're tightening things, but if we're putting an implant in, we actually need that skin and breast tissue to cover the implant. So you typically can't use as big of an implant when you're doing a combination procedure, also known as a mastopexy augmentation. If you're interested in learning more about this procedure, you can scroll down to the bottom of the page and book a consultation with us, and I'd be happy to talk to you about what your best options might be.